Hello, everybody. Simulation is now widely used in education, as well as many areas, including business. Past like 15, 20 years, simulation becomes a very important tool for the medical education and the physician's training. Today, it is my pleasure to have Dr. Ben Berg, who is the pioneer of the simulation in University of Hawaii, John M. Barnes School of Medicine, and currently director and leader of the simulation center called SimTiki. And I'm sure he's going to talk about the past, present, and maybe future of the simulation. And then we can discuss further together about simulation, which may be very helpful for the young generation to learn about simulation, but also maybe become a physician in the future. So Ben, thank you for joining me today, and I'm happy to talk to you and listen to your presentation.
Junji, thank you so much for inviting me to share a little bit about simulation and maybe a bit more about the pathway that led me to this somewhat unusual enterprise in medical education. So I'll share my screen and we can begin to hear a little bit about my journey to this profession of education in using the methods of technology and simulation.
Okay, this is a 144 YouTube series of the present to the future doctors. And today's speaker or presenter is Dr. Ben Berg, who, as I told you already, the director of the SimTiki. And he wrote some like a catchphrase, "Forks in the road, finding and following your professional pathway." So now all yours. So I want you to start talking about whatever you presented.
Sure, I'd be very happy to do that, and appreciate again the opportunity to join your very important work in sharing ideas about education and medicine for future doctors in a global perspective of simulation, of other parts of education, of how do doctors become doctors in many different parts of the world. It's so different. So this is a nice photograph of our home in Honolulu in the evening time, which is quite lit up, and I hope that people have a chance to visit us at some time. So, as Dr. Marchi said, my name is Dr. Ben Berg, and I'm a professor of critical care medicine and the director of Simulation, which is technology-based education center that we call SimTiki at the University of Hawaii. So let me tell you a little bit about what is simulation and what do we do with simulation? Simulation is a teaching method that uses active teaching and active learning methods, which is quite different than the methods of traditional education, even in America. The traditional methods of teaching and learning using memorization and lectures and observing are somewhat passive. And teaching with simulation, as you can see in this slide, is quite active. The teacher is the doctor in the white T-shirt. She is teaching medical students about inserting a central venous catheter into the jugular vein of a simulator. This is a simulator that allows us to practice and become quite experienced and skilled at this technique before ever touching a patient. This is the type of advantage to this, is that we can practice and actually become very good. This is similar to how airplane pilots train. They they train in simulators. And actually, for some of the major aircraft that we fly now, many of us back and forth across the Pacific Ocean, those pilots, they learned in a simulator, and maybe they became completely qualified in a
Mhm.
simulator before they could become the pilot of the airplane that is carrying us. We often speak about this uh, connection between healthcare simulation and simulation in aviation
Yeah,
because they
that's right.
both,
Yeah.
yeah, they both really are involved with people's lives
That's right.
and taking care of people and in some ways preventing accidents and problems from happening. So it's kind of high risk. It's a high risk enterprise. It's a high risk activity that we're involved in. So
Mhm.
training with simulation can really make things much safer for both passengers in an airplane and for new doctors who are just trying procedures. This slide shows our medical students who are involved in what we call SimFacts. It's a simulation fundamental acute care techniques. And we have our medical students in the second year of medical school who learn about many different acute care techniques using simulators. You can see this simulator is a little bit different than the one we just saw, the one for central venous catheter. This one is a whole body simulator. It's computer controlled and it can simulate many human functions like respiration and hemodynamic changes, blood pressure and pulses and pulse oximetry, oxygen saturation. It can simulate all of these things. So we can create many different types of conditions, medical conditions for medical students and residents to practice and learn about managing complex cases. So, this is another example of simulation. This is in our family medicine residency
I
program,
see. Okay.
and you can see the students. They are learning to do suturing and other surgical techniques like applying electrical energy, and they are using this simulator is actually a piece of chicken. It's not. So we're using that to represent human tissue.
See.
Um, our activity I've showed you so far, it includes medical students, it includes residents, and this is a simulation being used in what we call a pre-hospital pediatric simulation. So these are paramedics from
Paramedics, I
our,
see.
yeah, paramedics in Honolulu, and
Mhm.
they are working with this small simulator. It's a infant simulator,
Mhm.
and you can see it here. This is because the paramedics in our city and in most cities, they don't have much experience with pediatrics. Most of the calls for an ambulance are for
Right.
adults, and they need to refresh and practice again and again so that they can keep the skill of emergency care in the pre-hospital
See.
environment
This is
for
intubation they are trying to do.
they are doing intubation. They are also just managing and triaging the
I see, I
patient
see.
to decide do what kind of care do they need to do in the field. So they're doing a variety of things. You mentioned intubation. This is preparing for intubation with the bag mask ventilation,
Mhm.
but they don't get a chance to do this very much in real life.
Mhm.
So they come and practice with us periodically. So another activity, another educational program that we have in our center is for teaching educators how to use simulation as a
Mhm.
teaching method. We call this course FunSim, is
Mhm.
Fundamental Simulation Instructional Methods. And these are some examples of our faculty members who have been learning in a 2-day course how to teach using simulation. And this group actually is consisting of faculty members from our fellowship and some from Japan and Thailand and Korea. So we have a very international program. And you can see here many of faculty members who come to learn about simulation at our center are from many places in East Asia. So it's a really fun part of my work that I really enjoy is the international work, much like Dr. Machi is quite involved in international work and sharing ideas. I'm going to talk about that a little bit later in this presentation. Our work in simulation also includes research. In this slide, you can see this is representing the spine, and in the middle is the spinal canal, in which we can practice doing lumbar puncture, spinal tap, and this is a picture of a fellow from Japan, Dr. Yuaka Ishii, and he is involved in a research project to try and understand how effective is it to teach using this method and also using this specific simulator. This device, it was manufactured in Japan by the Kyoto Kagaku company, and we are trying to learn how well does it predict performance in real life. So this is the type of educational research which we are involved in, and we've had quite a lot of success with that. And it's, again, one of my passions is research, teaching and research and simulation. These are all things that make my professional life quite rich. And
And
further on in
busy.
the present, and busy, you are very right. And this is an example of both doing teaching and research at the same time. This is one of our fellows, also anesthesiologist from Japan. He has volunteered to be a model
Hmm.
for a medical student who is practicing ultrasound, cardiac ultrasound. And we had some research involved with this as well that was published. And so simulation is a very active use of technology in teaching in a way that is quite different than in the traditional methods, as I
Hmm.
mentioned before. Our international work and what I really love the most is focused in many different East Asian countries, including Korea. We had a faculty development program there several times, and then in Thailand as well. These are some workshops in Thailand and in Japan. A
I know
variety.
you go to Japan very frequently. You're very famous in Japanese medical school.
Yeah. Well, it's one of my favorite places, and I have a lot of really good friends there. I could not do my work in Japan without my colleagues and partners in Japan who have helped to develop simulation as a specialty of medical education in many places in Japan, and it's growing now. So I'm just so honored to be a part of that at the invitation of my colleagues in Japan. Here you can see uh, in the last Japanese Society of Medical Education
That's why, yeah.
meeting here. This was in Tokyo at Teikyo University, and some of our previous fellows from Akita and Tokyo and from GK also are here in this photograph. So I hope that part of my presentation is able to introduce you to this very broad application of technology-based education using the simulation techniques.
So
So,
how long is a SimTiki? More than 10 years?
yeah, we began this center in 2005. So
Oh,
it's 20,
wow,
20
20
year,
years
20
now.
years now.
Wow,
Yeah.
surprise.
And I was very lucky to be a member of this center at the time that it opened, the founding director of this. So I was so lucky.
Yeah, you are the best, I think.
So my idea with this presentation for the rest of it is to share with some medical students in Japan about what is the pathway to how does a doctor become a professor of simulation. It's a
Mhm.
really the connection is not so obvious always. So I like to tell a little bit about that, and also this will help to have students begin to understand how the pathway to professionalism, to the doctor, um, development of their skills and knowledge and interests, how it compares and contrasts a little bit in Japan and in America. So I want to tell you a bit about this.
This is interesting. I didn't know this word simulationist.
Yeah, that's become a really common word now that is in use in this
Uh-huh.
community of professionals who are very active in simulation work.
I
So
see, I see.
it's a kind of new domain in healthcare education,
It is,
and it's
uh-huh.
not only for medicine but also for nursing and other healthcare professions.
Right. Uh-huh.
So, um, how did I become a simulationist? Uh, this word did not exist when I was in medical school. And I put the fork in the road here as a symbol. This is a American terminology about something that I will introduce to you about the fork in the road.
Oh, I see, I see. A fork
This,
meaning this fork.
yeah, this is a fork, and this is a colloquialism. It's a uh, American terminology that maybe is hard to translate or nobody would understand what this
Uh,
means. So I'd like to just introduce you to this term.
I see.
This term is what we call when we have to make a choice.
Uh-huh.
Sometimes we reach a fork in the road where the road is splitting and we have
See.
to decide which way will I go.
Mhm.
And we say in English sometimes, I reached a fork in the road. I must choose which way to go.
Oh, I see, I see.
Oh, and you can take the left fork or you can take the right fork and follow the road on whatever journey you will pursue. And I'll tell you about many forks in my personal road to becoming a simulationist. How did this happen? I didn't know the word. There was nothing about simulation when I went to my medical school. So I'll tell you about my pathway. Explore my journey a little bit, if you will.
Okay.
So my journey began in college, in
Mhm.
university. In America, students join a university for 4 years and then they apply to medical school, and it's very competitive. When I went to college, I enjoyed being in the outdoors and working to improve the environment. This focus was quite aligned with my idea that saving the environment was really important.
Mhm.
And slowly, I began to evolve and think a little bit more about what I was doing.
Mhm.
Um, I was very interested in birds, and
Oh.
I was working in bird biology. I was working in understanding some of the biology and environmental impacts of pollution on
Oh.
birds. I did not start thinking about medicine. I
Oh,
was
I see.
thinking about the birds and biology and the environment. It was really exciting to me because I liked being outside all the time. I enjoyed hiking and being in the wilderness in remote areas.
Mhm.
So this was the beginning of my academic career. And I reached a fork at one point in
Okay.
college. I began to think about medicine, maybe because the environment is so important to human health, also, not only to the health of birds and other animals. And I began to think about maybe I would be a doctor to improve human health. And I reached the fork and I had to think about this a lot to decide, do I want to follow my interest in birds
Right, I see.
or do I want to follow my interest in medicine?
I see. Difficult
So,
decision, yeah.
this was my decision, my first fork in the road on the way to a profession as a simulationist. So, I began to think about this career. And as I decided I will do it, I had one barrier. I needed to
I see. You have to study a lot.
study. I needed to study a lot. And It was a different type of studying than I had experienced as I was beginning with a career in biology and environmental science and that kind of thing. But I got so interested in medicine that I said, I'm going to try to study really hard.
In the
I
room, not the outside.
That's right. Mostly inside now, not so much climbing mountains in in the forest and those kinds of things. So I now want to fast forward a little bit. This was my university,
Uh-huh.
and then the next road was I will go to medical school,
I
and
see.
this was my medical school
Tufts is
in
very famous medical school, I think.
yeah, in Boston, in Massachusetts, on the east coast of the
Uh-huh.
United States. And then I had the next fork was to decide what kind of specialty and where will I go.
Mm.
And I went to a hospital called Walter Reed Hospital for my residency in internal medicine.
Mhm.
Several more choices, several more forks in the road to decide what specialty will I do? What kind of things will I do next? You'll notice that this was the east coast of the United States, and all of these photographs they show red brick buildings.
Oh, that's
It's
right.
so common. It's like Tokyo Station, actually, right? The same kind of architecture that influenced by European architecture and things. So I went to this hospital, the Walter Reed Hospital, which is here, first to the University of Massachusetts, to Tufts Medical School, and then to the Walter Reed Hospital, where I was inspired by a mentor. And one of the things he inspired me to do was conduct research. I was quite interested in conducting research during my internship and residency and fellowship in pulmonary and critical care medicine. And I began to publish some articles. This was a long time ago. This was in 1989. I published my first article about COPD and altitude, some of the effects of physiology on the lungs of people who had some medical problems and they had to go to altitude in an airplane.
Hmm.
So we studied patients with lung problems when they go inside an airplane and the pressure decreases and the oxygen decreases. And we tried to understand more about how that affected them and
That's
how
very
we could
cool.
help them.
Uh-huh.
So this was still a very long way from simulation. This has nothing to do with simulation, but I found a new fork. I decided I would start a career that was focused on research and
Uh-huh.
physiology. And as I did that, I also became an expert in respiratory disease, in bronchoscopy, and in the physiology of breathing tests, which you can see here is how we look at some breathing tests. And the bronchoscopy is to put a tube inside so we can look clearly at the lungs or some of the structures internally. Um, and my practice of medicine brought me to Hawaii, where there were no red brick buildings. Now we had big pink building.
I see.
So it was a new experience for me. And I also began to learn a little bit about, in my practice of pulmonary disease later on, that the Japanese practice in this specialty is quite different than the practice in America. For example, in Japan, a respiratory specialist, a respiratory disease specialist, they will take care of administering chemotherapy, treatment for cancer. But in America, only oncologists do that. The respiratory doctor doesn't do that. So I'm beginning to learn about differences in the practice in different specialties in Japan and in the United States. So as I practiced medicine in this hospital in Hawaii, I became very interested in teaching, and I was involved in teaching in a residency program, and I became the residency director, and teaching became my new passion.
see.
At first, my passion was birds, and then I had to work hard to go to medical school, and then my passion was research, and my passion next was all growing and growing together. Next, it was to be a respiratory physician specialist, and now teaching was becoming a very important part of my work. Another fork. I decided I have to learn a lot about teaching and education. So I had to study more and learn about that. And the next fork was I had a chance to develop a telemedicine
Oh,
program. And this telemedicine program from Hawaii, it included Japan, Thailand, and Korea, places where my organization, I was in the army and I was in an army hospital. And we had army hospitals in Japan and Korea and Thailand. So we developed a new method of supporting and having consultation and experts that can be in Hawaii that can help in a small hospital that maybe is in Japan. It was in Okinawa and Yokosuka that we
oh.
were conducting our programs in Japan.
Telemedicine is now pretty getting popular, but you're talking about this maybe many years ago, right?
This was many years ago. This was 1990.
Ah,
It was the first telemedicine program in Hawaii, and it was a critical care. It was
oh,
intensive care medicine that we were providing support for.
that's great.
So, so you can see now as a young doctor, the pathway can take you many different directions. And I think for me, this has been so exciting to keep discovering new things and learning
Uh-huh,
new things. It's one of the most wonderful things about medicine. Everything changes and we
uh-huh,
can learn new things always.
that's right.
So um, the practice of medicine now it was involved with research and teaching and some international work also. We had research and teaching, and it was involved in international work. And one of my projects required us to use a simulator because we could not study the research on humans. We had to study the research on a simulator. So now I have three different interests,
See,
many different,
coming
many,
together.
many different pathways. So this was the beginning of the pathway which led me to my interest and experience in simulation as a unique specialty in medical
Mm,
education, technology based. So I took the pathway to the John Burns School of Medicine, which is here in Honolulu, Hawaii, where I have become a faculty member. The opportunity to become the director of the new simulation center in 2005, as I said, 20 years ago, it was new.
mm,
And I had some experience, a little bit, but all of the forks that I chose, all of the roads, pathways that I took, prepared me for something new and exciting.
mm,
I'd had a experience with technology through telemedicine and teaching in the residency programs and acute care medicine as a respiratory specialist and intensive care doctor. All of these things prepared me and made me um, able to take the opportunity to join the University of Hawaii. Now I have been here for more than 20 years, and every day continues to be very interesting and exciting for me. And I never planned on becoming the director of a medical school simulation center. I had no idea what that was, and but it was a perfect chance for me, and it's
mm,
been so wonderful. The idea that we can use simulation um, as a language for sharing ideas is one of the most exciting things to me. I mentioned we can use it for teaching and we can use it for research and we can teach paramedics and medical students and surgeons using these types of techniques. But I think we can also use it as a common language between healthcare professionals and even between medical students. In our center, we have uh, medical students from Japan join medical students from Hawaii for 2 weeks in the summertime, all in a setting of learning using simulation. And they can learn together and teach each other. And it's very active, really different than sitting in a lecture with somebody. So we find that is like one of the most exciting things. And it helps us understand, how do we practice medicine in Japan? How do we practice medicine in America? I mentioned some difference between pulmonary or respiratory doctors. What is the scope of how do they work? And how do we teach? We teach differently in America than in Japan. There are different systems. I told you the system for medical school, it's 6 years in Japan and only 4 years in America. So we teach quite differently. And I think we can learn a lot about the differences if we are working with a lot of interaction in simulation. This is an example of Japanese resident who is in our center, and he's just a few weeks ago practicing and learning how to do cricothyrotomy, an emergency life-saving procedure that is rare. It's not done very often. We learn from each other, and we discover new techniques and new methods of learning and barriers to communication, right? There are barriers, language and culture, but in simulation, do you have my screen still?
Yeah.
Yep, you have it. Okay. I think I lost it a little bit, but we have here a student using an ultrasound, and this is not simulation, but you can think of it. Maybe this model is actually a simulator. He is simulating being a patient. He is
Yeah.
not. He's not really a patient. So you can see that. And then the next one is again working with our pediatric simulator. So this is how we share ideas and thinking face to face, really different than just giving a lecture like this one. You can learn a lot from me by a lecture, but you can learn more from many people. You can see here, this is 3 or 4 people who are working together in here, and there's a instructor there also. And this is really intense learning and deep learning, which can happen in that kind of a setting. So this was the journey which I took,
I
and
see.
I want to share with you some ideas about how this journey can guide you to think about, look for the opportunities. Sometimes you don't see the fork in the road. You just follow one pathway. But if you keep your eyes open and looking for different opportunities, you may find yourself in a very different place than you expected to be. And it may be a very good place for you. So my recommendation and my last words for the presentation are that you should find your best journey. You should find the fork in the road that is the best for you and explore the fork. You can go down one fork, and if it's not for you, you can choose another way. So this is my final slide with that recommendation: to keep your eyes open, look for different opportunities, and find your best journey.
Great. Thank you very much. It's a very nice talk, and maybe good your past journey may be very helpful for the young generation who may moving forward in the future, I think. Thank you very much.
Yeah, I hope it's interesting, and I think this has been a great opportunity to share some of my ideas. And thank you so much, Machi Sensei, for
Okay.
inviting me to
Sure.
join.
Thank you, Ben. It's very interesting presentation, and I understand. I didn't know your past, journey. you You moved
Yeah,
this way, the other way, but finally came into the simulation. But
yeah,
it's very interesting yeah, past, and present, I think. And actually, in my life, particularly because I finished medical school and residency in Japan, and then I decided to come to the United States. That was my, I reached to the fork in the road, what should I do?
yeah,
And there's a lot of some difficulties, but finally I came to the United States, and now I'm doing a practice surgery, also teaching and some research, and also particularly I'm very interested in education right now. That's the reason why I go to Japan very frequently. Um, yeah, initial presentation about simulation is very helpful to understand for the people, maybe high school student or new medical student, what simulation is and gonna be. But in the future, maybe simulation has been changing, right? Many technologies changing. And
right.
actually, Kyoto Kagaku is a company, Japanese company. I have been working together many years. I know you went there many times, but so I'm pretty sure simulation gonna be changing in the future. Probably like involving a more AI technology. How do you think about the
Yeah.
future of the simulation?
Yeah, so it's a really popular question now is what is the future because the technology is changing so quickly.
Hey,
And I want to just recognize that you are really the inventor of some of the very earliest and still very effective types of simulators for
ultrasound, yeah.
ultrasound phantoms for
Yeah.
teaching and learning about ultrasound techniques. So we owe you a lot for promoting the concept and introducing this very effective teaching tool in Japan. But now the question comes to how do we begin to integrate things like virtual reality
Uh,
and artificial intelligence into simulation? And I think there's a really great opportunity to advance simulation. And I think that it requires very careful attention to the detail of using it most effectively. Many times in simulation, the technology is very interesting, very powerful, but we don't know exactly how to match it to the best teaching opportunity. So I think this is a new horizon for us to begin to use the technology of virtual reality and also artificial intelligence to guide the student simulation experience in a way that is perfectly matched to that student. Many times now we teach a group of students. We say this is a course for second year students or third year students or fourth grade students. But now with AI and the very adaptable simulators, I think we will begin to understand how we can best help a specific individual student. He or she needs a little bit more work in this area
I
or
see,
a
I
little
see.
bit more work practicing this. And then we can focus the teaching in a way that it becomes very, very effective.
Maybe more
Uh,
like individualized,
yeah,
right?
it's individualized teaching in much the way that we start to think now about individualized medicine,
Uh-huh.
personalized medicine. We are thinking about
Personalization, yeah.
genetics and things like that that can give personalized medicine. But maybe personalized teaching is the next horizon for the new technologies and intelligence capabilities.
Very good. And the other things when you're talking about simulation, simulator, many people get involved and sometimes, do like the teamwork, right? And
Mm,
everybody have some idea, sharing the idea and doing a
right.
teamwork. And these are very important for the future young generation to do like a collaboration with other people and making a connectivity to other people. So simulation education is one of the tool to for them to understand collaboration, connectivity, and other things also. Yeah.
Yeah, you know very well about that concept that simulation is a great way to teach that kind of collaboration or teamwork. And we know very well now that good teamwork means good patient care. If we can work together well as a team, and I think there's quite a lot of interest in this, not only in America but in Japan. From my knowledge and work in Japan, that this is quite an area that's quite interesting. And the part that's kind of interesting is this is an area in which now nurses and doctors can work together and train together.
Yeah.
They work together, but they don't always train together or learn together. So it's a great opportunity for even medical students and nursing students and medical engineers in Japan to actually work together in a simulation environment in which they're working in much of the same way that a team works in a hospital or in a clinic or in an operating room or something like that.
Interprofessional education, right?
Right, exactly. So it would be, sometimes we can do this without simulation, but simulation is another tool to use for that. I like the fact that you use the word tool. Simulation is just a tool. It's like a PowerPoint or like a lecture. We have many different educational tools, and simulation is one, and it's good for some things. It's not good for everything, but if we match it to things that we know are effective, it's that's a big part of my work, is the research part of trying to find what's the best way to use simulation.
Okay, thank you very much, Ben, and I hope you continuously teaching in Honolulu for the JABSOM student or resident, but also frequently go to foreign countries, particularly Japan, and teach them also.
Great. Thank you so much for inviting me to spend some time on this presentation and great discussion that we had. Thank you
very much. It's great to have you in this series. Thank you, and we'll see you in sometimes in in a real life, not the Zoom.
Okay.
Okay. Thank you very much.
Great.